Hi there. In this video I'm going to be using a Swiss ball, as is obvious. You can use a stool or something, but my preference all the time is a Swiss ball because it just adds so much more to this exercise. That'll become clear as we go in. The exercise in question is a continuation to the deep abdominal activation, and this one's just a little bit more challenging, but it's meant to be challenging without taking you into a position where the spine becomes a little bit more vulnerable for those people who have suffered from things like a Spondylolisthesis or a pars defect or a stenotic spine or any sort of chronic low back pain situation. This one is going to really try and focus on that deep abdominal canister. So if you haven't looked at the introductory video I've done for that deep abdominal activation, take a look at that one. The link's in the description for this video, and that will make much more sense than looking at this technique if you've got a good basis from that first technique. Anyway, we're going to start off in a modified rest position. The difference being is that you're going to have one leg up on the Swiss ball. Now, it just needs to be offset to one side to make room for the other leg, and I think it's important that the Swiss ball isn't being braced against the remaining leg on the floor, because that will be too much of a substitute for the stability we're trying to get. Now, I suppose the comfort is everything here. You can have your heel resting on, but what you don't want is for your knee to be too far past your hips. You could have your calf resting on it instead. What you'll find when you're doing this is that the amount of surface area of your leg you've got on the ball will have a direct correlation to how difficult the exercise is. So the more of your leg you've got resting, for instance, if you had it tucked right up and you had the back of your thigh and your calf on there, you're going to get much more purchase on the ball and perhaps lose a little bit in terms of the challenge. But if you find it overly challenging, obviously this is the modification. My preference is to get the heel on there, or maybe the foot, depending on what's comfortable, and then you've got much more stability challenge. The other foot needs to be bedded into the ground, and that remaining leg needs to have the knee vertical. Don't forget that you don't want that leg drifting around. It's not just there as a sideshow, it's an important aspect of denoting the core stability required for this. So in follow-up to the abdominal activation exercise I did in the other video, it's pretty much the same technique, but the difficulty comes with the elevated leg. So we start off from our rest position, fingertip gap underneath the base of the spine, and then you're taking that breath in to prepare. As you breathe out, you're flattening the back by way of that deep abdominal diagonal pull, and then scooping the tailbone up. But you want the muscles in your back pockets to be as relaxed as possible, so that you're facilitating this lift up, and you're flexing the lower aspects of the lumbar spine. So lots of the lumbar spine will still be on the mat, and you're scooping up at the base, courtesy of that abdominal activation. So when you're trying this, you're probably going to find that this leg starts moving around all over the place when you're not used to it. So each time you go up and down, the stillness in the ball and the stillness of the remaining leg will be a nice window into how well you are able to execute the equity through all those deep abdominal muscles. So take that breath in, breathe out to gently flatten and scoop up, pulling that diagonal from the inside of the belt line down towards the lumbar spine, and getting that sensation of the ASIS, the bony prominences of the front of your pelvis being pulled inwards as if you're tightening your belt. So you've got that really nice kind of vacuum effect. And then you can focus on width ways expansion in the chest wall, trying to keep those core muscles engaged, and trying to keep that ball still, trying to keep the glutes relaxed. It's a real challenge. The height at which your tailbone comes off the floor is, again, directly related to the effort that's needed. So if you do progress on a little bit, start with that deep spinal, that lower spinal flexion, and then think about that string of pearls analogy where the tailbone goes up and just pulls up one vertebra at a time, pulling that deep abdominal belt line in, trying to hold the ball still if you can, and for every level you go up, you're going to be working a little bit harder, but you're really focusing on spinal flexion the whole time. So because this is, I suppose, coming under the umbrella of a rehab exercise, It's not one which I'm suggesting you plough up into a full shoulder bridge. You need to be careful because, as my Paul kind of says goodbye, it's coming back, get back round, have a mind of their own and those things. The point with this type of exercise is it's addressed for people who have difficulty controlling dysfunction in the lumbar spine. And when I see people go up into a shoulder bridge who have those sorts of conditions, they will always favour a braced or an extended lumbar spine. And this is trying to do the exact opposite. It's trying to get that lower lumbar spine flexion, and then if allowed, increasing amounts of flexion, but while maintaining the lower lumbar flexion. So that's the point here. It's getting that deep abdominal musculature doing that, rather than just hammering through the glutes and the hamstrings to lift you up. That's a very kind of indiscriminate shoulder bridge and will not do much to identify and tackle and improve the lower abdominal muscle dysfunction that's typically seen when people have those spinal conditions I mentioned before. Final note there, again, because this is within the context of rehab, if this technique starts antagonizing your back, you notice when you go up it's just difficult, or the other hamstring's really jumping in, either just really reduce the height to which you're lifting, maybe just that tailbone scoop, or you might have to give it a miss and consult with a trusted medical professional or exercise practitioner if that happens. But it's important that you're doing this slowly, intentionally, and you're not triggering any symptoms, and you're gradually building the endurance, the amount of time you can hold in that lifted position with the ball staying still. And it's just one way you can access that deep abdominal musculature, which hopefully goes some way to alleviating symptoms.